to speak about measuring primary care access for new patients on the eve of healthcare reform. And I'd like to acknowledge that this is a team venture, and particularly I'd like to acknowledge my co-PI on the project, Dan Polsky. The project is motivated by concerns under the Affordable Care Act that with approximately 25 million more people gaining coverage, that there might not be enough primary care providers to take care of them. So the key question is how access to primary care will change when there are more people with health insurance. So the goal of the current study was to generate baseline estimates prior to the insurance expansions by insurance status. So we used a simulated patient methodology where the researcher poses as a customer to evaluate customer service. It studies real-world behavior, in other words, what people do, not what they say they do. And that overcomes biases related to social desirability and response biases that are found in physician surveys, and can control for patient factors such as the need for care. But it requires a deceptive design to observe business as usual. So we measured specifically 2 dimensions of access, which are the likelihood that a non-elderly adult patient, the group most likely to gain insurance under the Affordable Care Act, can obtain a new patient appointment, and conditional on getting an appointment, how long do they have to wait? So we selected 10 states based on a whole variety of characteristics. We really wanted diversity, but these 10 states account for approximately a quarter of the non-elderly Medicaid and uninsured populations nationwide. So our results. So between October 2012 and March 2013, we completed almost 13,000 simulated patient calls to approximately 8,000 practices. And here's our results. So across, on the far right, that's the sort of 10-state simple average, and within each state, there's a weighted average by county, and across all states, Medicaid was less successful in getting a patient with Medicaid would be less successful in obtaining an appointment than a privately insured patient. What you should know here is when we called with private insurance scenario, we we said we didn't volunteer insurance status in any of it, but when asked, we used the largest market share insurance plan, so sort of a best case scenario for private. And when we called with Medicaid scenario, we only called providers or practices where we had some indication that they actually accepted Medicaid. We had done a pre-call through, a non-deceptive survey just to see if they accepted Medicaid, supplemented by state Medicaid insurance lists. So the Medicaid 58% success rate is within the approximately 65% of practices that actually accepted Medicaid. So so best case scenario for the Medicaid patients as well. Now we had an uninsured scenario, and in that case we basically said, so I don't have insurance. How much will the visit cost? So we got a total cost for the visit, and then how much would I need to bring to the appointment or pay at the time of the visit? So for that, if there's no, how much it would cost and there's no cost constraints there, it was pretty similar to private insurance. But Urban, who's Urban Institute, is one of our research partners here, actually ran some numbers from the current population survey, the most recent one, and 2/3 of the uninsured patients in our 10 states are under 200% of the poverty level. So we sort of did a post hoc, how many people, what percent of uninsured callers could have gotten an appointment that only required them to bring $75 to the visit or less. And in that case, the appointment success rate falls to 15%. So in terms of if you got an appointment, there was really no difference between private and Medicaid in terms of how long you had to wait. So the barrier is on the front end, but if you get an appointment, it was approximately the same. We also had an urgent scenario where I found out I have high blood pressure and was told to see a doctor right away. There was no difference between routine care and a private scenario as well.